Hello people, in this video we are looking at this book Practical Aspects of Pediatrics by Mayoor K. Chedda. So this book could be useful for history taking in pediatrics, case discussion. Let's look inside. Lot of images, lot of tables, all instruments etc. are also there in this. Here are the contents. So now let's look at some details. In exam, the main things you will get will be cardiovascular system, some kind of a ventricular septal defect usually. Then you can also get rheumatic fever. In nervous system, mainly you will get, I'm thinking you will get acute flaccid paralysis, cerebral palsy, very common because when you see meningitis etc., these are conditions that require treatment and usually they don't keep acute conditions in the exam. Okay, so you will get a cerebral palsy probably, and then you can get a case of pneumonia, you can get a case of anemia. Yes, mainly protein energy malnutrition you will get, this one, and you usually get Downs, you will get hypothyroidism probably. What we got was diarrhea cases they will keep. Did they keep here? GI, there's no diarrhea here. I think there should be a diarrhea case here. Okay, a diarrhea case should be there. In pediatrics history taking, you usually draw this pedigree chart, family tree. Yeah, and you should know national immunization schedule. So when do you give MMR? 9 months. And 1.5 months. Okay, MR is in the national immunization schedule, MMR is in the IAP schedule. Now let us look at some spotters. What do you say, people? What are you looking at here? Did you guess? It's low set ears. Where will you see low set ears? Down's syndrome. Okay, and other genetic malformations. So what are you seeing here, people? Yes, you're seeing vesicles. So what is this? Vesicular rash of chickenpox. Very good. What are you seeing here? Let me show you here. This place. This is the angle of the mouth, isn't it? What are you seeing here? Chiliosis. What is chiliosis? So angular chiliosis, the differentials are riboflavin deficiency, drooling of saliva, fungal infection, syphilitic ragades. So let's go with some deficiency, that which will not remember. Riboflavin, that is vitamin B2, isn't it? How's it going, people? Are you ready? Look at this one. What do you see here? This is congenital cataract. So what are the causes of congenital cataract? Prematurity is the most common cause of cataract, it says. I know only the storch infections one. All the rubella, etc., isn't it? Then, standard things you will write is hereditary, chromosomal anomaly, etc. Metabolic causes, you should know this galactosemia, isn't it? Hypocalcemia, galactosemia. And this hypoparathyroidism goes along with this hypocalcemia. What do you say, people? Guys, now let us do one thing. Let's look at a case, okay? in pediatrics and how to handle it. Now let us say nephrotic syndrome, you have a case, okay? So what and all are the chief complaints? Anasarca, generalized edema. What is anasarca? Generalized edema, oliguria. Correct? So oliguria, and this is what the patient's mother or father will complain of, or the guardian will complain of. However, what will be the findings in nephrotic syndrome? Proteinuria. So basically you will have proteinuria greater than 3 plus or 4 plus. This is what they are saying. Then hypoalbuminemia. So there's less albumin in the blood. Focus people. Hyperlipidemia. So there will be what? Fatty cast, frothy urine, etc. Remember? Oh, sorry. Hyperlipidemia in the blood. In the blood there is high lipids because the liver is trying to make more protein. It is also making lipids. So this book gives you a lot of information, the etiology, why does nephrotic syndrome happen, right? What are the types of nephrotic syndrome? Then what is the histopathology? How many types are there? Like minimal change, focal glomerular sclerosis, etc. Right? Then pathophysiology, you should know why is the protein being lost. Okay, why is there protein in the urine? Why is there hypoalbuminemia? Because always the albumin is in the urine, so it is less in the blood. Hyperlipidemia, it occurs why? Because increased synthesis of lipoproteins in the liver. Why is liver synthesizing excess lipoproteins? Because it is trying to make the proteins which are being lost in the urine. Okay, so that is nice. Then why is there edema? Hypoalbuminemia, so there is edema. So you understand that, isn't it? Then so a lot of information has been given here. You can look at all these. What are the complications of nephrotic syndrome? Thromboembolic complication. So this is interesting. There is less protein, but there is more fibrinogen, etc. They are saying, right? So these people are prone to infection, growth retardation. They can go into cardiovascular disease, etc. Okay. I think what you can also note here is hypertension, renal failure. I think these are easier to say. What do you say, people? Somehow the treatment part of it is not that satisfactory in this book. You can look at it. Mainly we write in theory. How do you write? Steroids, etc. You write, right? See here they have given specific management, prednisolone. This is very important, right? For relapse, you will give, again, prednisolone, some other dosage, cyclophosphamide, etc. for steroid resistance. Okay, guys, focus here. What is the difference between nephritic and nephrotic? Nephritic is where there is hematuria. Nephrotic is where you have the frothy urine, fatty cast, etc. In this, you have something called as hemoconcentration. Okay, so the hemoglobin increased due to hemoconcentration, they are saying. Okay. So guys, in general, we have looked at one sample case from this book. I think that's enough for now on this book. Hope you can pick up this book and get more details on every case that will come for your exam. These books are very essential apart from your textbook. Okay, because this will help you clear your Viva for your specific case given to you. Okay.